meets to discuss the horrific abuses and neglect of children at too many residential treatment facilities, places that say they provide behavioral health care to vulnerable kids, but often leave them harmed and more traumatized than they started off. Just this morning, the committee released a new investigative report with shocking details about the treatment of kids in these facilities. And these facilities get big dollars from programs under the jurisdiction of this committee, specifically Medicaid and child welfare funds. There are endless examples of sexual, physical, and verbal abuse, improper restraint and seclusion on young children, unsafe and unsanitary conditions, and even a total lack of provision of behavioral health care. Unfortunately, it seems more often than not, abuse and neglect is the norm at these facilities. And they are set up in a way that makes it happen. The system is failing, except the providers running these treatment facilities who have figured out how to turn big profits off taxpayer-funded child abuse. I don't say that lightly. Our staff spent several years looking at the biggest companies in the industry: Universal Health Services, Acadia Healthcare, Devereaux Advanced Behavioral Health, and Vivant Behavioral Health. Our investigative team reviewed 25,000 pages of company documents, had dozens of conversations with experts, pored over article after article, and saw the problems firsthand when they visited the facilities. Overwhelmingly, it's clear that the operating model for these facilities is to warehouse as many kids as possible while keeping costs low in order to maximize profit. That means intentional understaffing with persons who have zero experience or qualifications to provide the care these children need. As Jay Ripley, the co-founder of Vivant and two other companies once remarked, and I quote now, "You can make money in this business if you control staffing." It also means facility conditions that are often unsanitary and dangerous. Facilities that feel more like a prison than a safe place to help a child get through a difficult time. In these conditions, children can't get the care they need, like high quality and individualized treatment. As if profiting off rampant abuse and neglect of our kids' most vulnerable kids wasn't bad enough, these facilities rely on enormous amounts of federal funds. That means that American tax dollars are funding the kind of abuse our investigators found. In some cases, these facilities receive over $1,200 per day per child from the Medicaid program. The experiences and trauma these kids are left with reads like something from a horror novel. A facility routinely restrained children, for example, drugged them, placed them in seclusion in clear violation of federal rules. Another facility saw a child ran away from the program in the middle of the night and was fatally struck by a truck. The staff at the facility tried to cover up the neglect, falsified documents about the child's whereabouts. Another child was sexually abused by a staffer on an ongoing basis. When the facility caught on to the abuse, instead of firing the staffer, they simply moved them to a different wing of the same facility. Each night, the staffer returned to the child's window to say goodnight. There are instances of child fatalities, both at the hands of staff and death by suicide. Unfortunately, the accounts of abuse we hear about today are not outliers. They amount to a systemic culture of mistreating and abusing kids and turning a profit. We gave the CEO of the nation's largest provider the opportunity to testify before the committee today, and he could defend how the company treats the children in his care. It is disappointing but not surprising that he declined the invitation. His company's conduct and the very business model that we are talking about today is, in my view, indefensible. So the question everybody in this room ought to be asking themselves is, where do we go from here? I want to work in a bipartisan way to shut off the fire hose of federal funding for these facilities to put an end to this cycle of abuse. The buck stops with, stops with this committee. In order to get a dime from Medicaid or any other program in our jurisdiction, all these facilities are going to have to start providing actual care. Systemic failures at even a handful of these facilities is an indictment of a flawed model. It's pretty simple. A facility shouldn't be getting taxpayer money if it can't prove that it's providing high-quality care. Finally, none of this matters if there's not oversight and enforcement. These facilities are often located in rural areas and function as black boxes that get left virtually unchecked. As a result, practices that should be used only in rare extreme cases like restraint and seclusion are being used regularly and being used by staff that's unqualified and poorly trained. At one Acadia facility in Arkansas, restraint and seclusion was used 110 times in just a month. Without clear nationwide tracking of these facilities, this behavior just slips between the cracks. There also, as part of our work, is the priority of making sure there are more community-based alternatives for care. We know this based on research, this committee's own experience passing the bipartisan Family First Law, and from doctors and patients themselves. The only people who disagree with this effort to have more community-based alternatives seem to be folks who have a financial interest in protecting the status quo. In order to reduce our reliance on fraudulent facilities and to reduce the number of kids that end up in them, investing in high-quality, community-based care must be a priority. It's simple. If you provide more care and support to kids up front, you reduce the need for residential treatment and the number of kids being subjected to these horrific abuses. What we found is that too often, kids in foster care are warehoused in these residential facilities for months or years with no plan to exit and no legitimate reason for being there. The federal government and American taxpayers have no business funding jail-like settings for foster care kids. So these findings demand bold action. In the coming months, I'm going to be working to bring my colleagues together behind legislation in this committee's jurisdiction to raise health and safety standards, require real oversight and enforcement, and invest in the community-based services that are proven to actually help kids. And I'm just going to wrap up and we'll go to the ranking member, but I just want to acknowledge all the survivors in this room. I met with many last night, again this morning, and I want them to know that your presence and the fact that you have been giving these accounts is what is providing the energy to finally get these long overdue changes. So my thanks to everybody who's with us today, who told me about their experiences last night and again this morning. Thank you for your bravery. As chairman of this committee, I am all in to stop the cycle of abuse that's been brought to light today. Senator Crapo.
Thank you very much, Mr. Chairman. I appreciate your holding this hearing today.